been seeing in many states that there's a growth of the cases. So instead of decreasing or plateauing, which they had been, they're now actually starting to increase day over day. And we're certainly seeing a persistent high number of deaths. So, 40 a day over the, past 7-day average. So basically, we are at a point where COVID's now one of the major killers of Australians, and probably by the end of the year is going to be one of the top 3 killers of Australians. And with an increasing case numbers and with, new subvariants coming in, this may drive it even further, which will have an even bigger impact.
But right now we have the highest infection rate in the world. That is a sobering statistic.
Absolutely sobering. I do think it needs to be taken into context. Many countries really are not still testing to the degree that Australia is, not recording rats testing. In fact, you look at a place like Denmark, they're actually recommending that people not test, that if you have symptoms of COVID, unless you're at higher risk of having complications and are eligible for treatment, that you don't even bother testing, let alone reporting. So comparing our numbers to other countries is more challenging now when, as compared to days when everyone was testing a lot. But there is no doubt that we do have an ongoing outbreak that is serious and may get worse in Australia.
So Nancy, many of us have now had the virus, and the general sense seems to be that it's a disruption, but it doesn't warrant the alarm that we experienced earlier in the pandemic, even though people are still dying, as you say, from COVID in Victoria today. For example, there were 15 COVID deaths reported. So how do you explain that disconnect?
Well, I think part of it is the miracle of vaccination. So, people talk about Omicron as being mild, but clearly the number of people dying from Omicron, aren't dying mildly. So it's a serious disease. And when some of the studies that have looked at it compared to other variants, when people aren't vaccinated, show it's as serious as other variants. The thing is, we've now been it's a highly vaccinated population. So we're seeing the benefits of that. And I definitely understand that it's not the same kind of crisis as it was in 2020. We have much more protection, and when we're gaining layers of protection. But that doesn't mean it's still not a major public health issue right now, a major crisis for us, a major challenge for us. And what I would say is I do understand that people are tired and want to get back to their normal life. But if we decide to live with COVID like we were living in 2019, to not really think about it at all, we're just going to have a very high level of people getting sick with COVID, people dying with COVID. And remember, a lot of us have had COVID, we've recovered, but about 5 to 10% of people that get COVID don't recover quickly. So even if you've recovered quickly and your family has, I'm sure many of us know somebody who just hasn't bounced back. An athlete at your kid's school who just isn't able to get back to their normal athletics, their normal routine, people who aren't unable to come back to work. So there's a lot of disability related to COVID as well, and that's important to think about.
So should some restrictions be put back in place?
Well, I like to think of protections, and I do think that some of the protections of society need to be considered. So indoor masks is something that I think doesn't stop anyone from doing and does anything, and does decrease transmission. I think doing some campaigns to really push boosters, we really pushed the primary vaccines and we really got people to get out and get vaccinated. But really at this point, we need people to get their booster dose. 30% of Australians don't have their booster. Many people who are due for that winter dose haven't gotten it. So we really need to prioritize that and really push that, because people's lives really do depend on it.